Wellness Week here on Daytime. All week long, we've been showing you the places that help keep your health and wellness in check. Uterine fibroids affect up to 80% of women, with 30% requiring some type of treatment to relieve painful symptoms such as cramping and excessive bleeding.
Dr. Gilma Gear, works with patients to determine their best course of treatment to make them feel like themselves again. Dr. Peer joins us now to share what options you have with her and the team at Silver Cross Hospital. Thank you so much for being here.
Good morning. Thank you for having me.
We hear the word fibroids a lot, but what are they actually? Is it a tumor? What is it?
Yes, great question. So fibroids are actually non-cancerous tumors that grow in the uterine wall.
Okay.
They're composed of the smooth muscle cells in the uterus. They get turned on and form these knots. They're actually really hard, kind of like fibroid, like calcified, like bone.
Okay.
Wow. So what causes them? I mean, we hear so much about them, but what causes them?
So the actual cause is not really understood. What we know affects them are race, age, genetics or family history, and hormones.
So how does somebody know that they have them? I mean, we've seen extreme cases where people almost look pregnant, but if you don't have that extreme of a case, how do you know you're dealing with them?
So the fibroid symptoms can be anything from fatigue because you're losing too much blood, to heavy bleeding, to pain, to low back pain, urinary symptoms, bloating, distended abdomen, sexual problems, reproductive problems. Any of that could be fibroids.
Because they can grow anywhere. They can grow in the uterus, they can grow on the wall, they can grow on the outside of it. I mean,
absolutely.
They just don't discriminate about where they go.
My little model here, but they can invade. They can be on the top surface, in this inner surface, or even in the wall. And where they are growing kind of dictates what type of symptoms you end up having.
I have had friends who've had them removed, and we're talking about a major surgery that took weeks and weeks to recover from. Is that typical?
Well, the good news is, and one of the reasons I'm really glad to be here, is we have more uterine-sparing options. And we even can start with doing nothing if the fibroids are small and not bothersome, to trying to focus on nutrition, because we know nutrition has an impact. But uterine-sparing, so uterine fibroid embolization, and now two things that we brought to Silver Cross, Accessa and Sonata. And those are treatments to shrink the fibroids. And then we have the standard hysterectomy, which we now pretty much do robotically, and myomectomy. So there are lots of options for women these days.
Yeah, because a lot of women thought that if I had fibroids, that meant that I had to have a hysterectomy, which meant that they could not have children.
Yes, absolutely. And we want to be respectful and responsible for women who are going through reproductive time. So we can offer them uterine-sparing options. So when they come to me, I like to hear, what's your goal? What are your primary goals? Once I hear their primary goals, then I can lay out what makes sense for them, so they don't feel uterus has to come out.
Oh, yeah.
Absolutely.
When do you go see a doctor? Because a lot of the symptoms that you listed, it could be a bad period. It could just be something because I'm tired because I've been working a lot. How do you know to see a doctor?
Just see them anyway.
Okay.
Because
there you go.
Look at where I look
when
at
in
it
doubt,
is,
get it checked out.
Get it checked out. Even if you think everything's fine, we should be doing our well woman exams anyway. Because sometimes I had a woman come the other day for her just routine exam, and I looked at her abdomen. She said, "Yeah, I just can't lose weight." No, she had a 3-pound fibroid that we just took out. She had no idea. And it was just with me talking to her and looking at her before I even touched her. I said, that needs to come out. We ended up taking it out. And she said, I had no idea. I've just been walking around thinking my stomach wouldn't be flat.
Oh my gosh.
Okay, so we talk all about the treatment. I'm all about prevention. Can you prevent fibroids?
So we don't really think you can prevent fibroids since we don't know what causes them. But we've got a lot of good information lately about nutrition. Green tea extract, turmeric, vitamin D. Vitamin D is what cures all of us for everything. But we're looking at vitamin D deficiency, and we realize that by improving our vitamin D levels, we are helping people to maybe shrink the fibroids or not grow so rapidly. So we may not prevent them, but we can at least kind of keep them at bay.
And if you go for an annual checkup, can you catch it, or does it grow really fast?
They can grow really fast, but annual checkups, you should be able to find them. Sometimes we order ultrasound, sometimes MRIs if we're not sure, sometimes just the physical exam and we can tell.
But when in doubt, get checked out.
Exactly. Thank you for that.
Thank you, doctor. We appreciate it so much. Hey, grab your phones and scan the QR code for more information about Silver Cross Hospital. Be sure to give them a call or visit silvercross.org. You can also follow them on Facebook at Silver Cross Hospital. To make an appointment with Dr. Pierre, her office number is also right there on your screen.